Ozempic costs nearly $1,000 a month in America. The same exact pen, about $83 in France. Today, we break down why that gap exists, where people are going to escape it, and what that escape is quietly costing them. First, the ground rules. This is a cost comparison, not medical advice. We are not doctors, and nothing here is a recommendation to start, stop, or buy any medication anywhere. Every figure you'll hear comes from publicly available data: the Kaiser Family Foundation, the Centers for Medicare and Medicaid Services, the FDA, the World Health Organization, and peer-reviewed research published in JAMA. Drug prices are approximate and they change often. With that said, let's follow the money. Let's name the thing. Semaglutide is the medicine inside both Ozempic and Wegovy. Ozempic is approved for type 2 diabetes, Wegovy for weight loss. Same molecule, two labels. In the United States, Ozempic's list price runs about $936 a month. Call it $1,000 every single month for a drug many people take for years. Annually, that sticker clears $11,000. Wegovy lists even higher at approximately $1,349 a month. And Rybelsus, the daily pill version of the same medicine, lands in the same neighborhood. Now hold that next to the rest of the wealthy world. The Kaiser Family Foundation compared the identical Ozempic across high-income countries. In France, around $83, in Australia, about $87, in Japan, roughly $169. Same pen, same manufacturer. Read those numbers again because they're almost hard to believe. Americans pay an estimated 5 to 10 times what every other rich country pays for the exact same injection. And here's the catch that traps people. What you actually pay in America is a moving target. With the right insurance, it might be a manageable copay. Without it, you're staring at that full sticker price. Even the discounted net price the system settles on behind the scenes, after the rebates quietly change hands, reportedly lands near $700 a month. Better than $1,000. Still nowhere near $83. Manufacturer cash pay programs have offered some patients a lower monthly rate, but eligibility is narrow and millions still land at or near full list. So when a drug costs $1,000 here and a fraction of that almost everywhere else, people start doing the obvious math, and some of them start looking south. In Mexico, the same semaglutide reportedly sells for somewhere around $200 to $370 a month. For someone paying full freight in the States, that difference can reportedly add up to $7,000, even $12,000 in a single year. That is not a coupon. That is a used car. So why does the identical drug cost a fortune here and pocket change there? It comes down to three things. One, for decades, the US government was legally barred from negotiating drug prices. Every other country on that list negotiates as a single national buyer. They walk in representing millions of patients and they name their price. America didn't. It paid sticker. That only just changed. Under the Inflation Reduction Act, Medicare negotiated Ozempic down to approximately $274 a month, taking effect in 2027. Sit with that. The government's own negotiated price is roughly a quarter of the list price. That tells you how much air was baked in. 2, the list price isn't what every party pays. Pharmacy middlemen, the benefit managers sitting between the drug maker and your pharmacy counter, collect rebates, so the so-called net price runs lower. But those discounts don't reliably reach the person without good insurance. The uninsured and the cash payer often get charged closest to the full number. 3, and this is the one that stings, researchers publishing in JAMA Network Open estimated that semaglutide could be manufactured at a profit for roughly $5 a month. One analysis put the floor under a single dollar, $5. And once the key patents expire after 2026, researchers estimated generic versions could be produced for as little as $28 to $140 for an entire year, not a month. The price you pay was never really about the cost to make it. It's about what the market will bear when one company holds the patent and demand is on fire. Even the manufacturer is now blinking. Novo Nordisk has said it may cut the US list price to about $675 in 2027. Lower, but still a world away from $83 in France. If your head is spinning trying to compare prices, programs, and the fine print, we did the boring part for you. There's a free, plain English GLP-1 cost and safety checklist in the description, what each price actually means, and the questions worth asking before anyone spends $1. No email gymnastics. Now, back to that border. With a gap this wide, what happened next was predictable. Bloomberg and other outlets reported that Americans started crossing into Mexico to buy semaglutide at a fraction of the US price. Some made it a day trip to a border city, others folded a pharmacy stop into a vacation. Quietly, a prescription drug became its own category of medical tourism. And on the surface, it looks like the same story we've covered before: Americans going abroad to escape American prices. Dental work in Turkey, surgery in Mexico. But this one is different. A hip replacement is a procedure you have once. A GLP-1 is a drug you refill month after month, often for years. That changes the math, and it changes the rules. Because the moment you carry medication across a border, you walk into a second set of questions the savings headlines never mention. Two of them matter most. Is it legal, and is it real? Start with legal. The FDA's stance is narrow, and it surprises people. As a rule, importing an unapproved drug for personal use is not permitted. Where the agency does allow an exception, the bar is specific, generally up to a 90-day supply for a serious condition, with a valid prescription from a U.S. licensed physician in original sealed packaging. And the details bite. Customs and Border Protection has indicated that a prescription written by a Mexican doctor is not accepted at the U.S. border. The FDA has also been explicit that this personal import pathway was never designed as a way to buy cheaper drugs. It exists for treatments you genuinely can't get at home. Semaglutide, you can get at home, you just can't always afford it. In plain terms, the cost-saving border run lives in a legal gray zone, and the rules were not written to protect it. Then there's the harder question: what's actually inside the pen? The global hunger for these drugs created an enormous counterfeit market, and the warnings are not hypothetical. In June of 2024, the World Health Organization issued a global alert on falsified semaglutide surfacing in multiple countries. Inside the US itself, the FDA confirmed that counterfeit Ozempic had slipped into the legitimate supply chain and seized it, and cautioned that the fake needles couldn't even be confirmed sterile. The cheaper compounded versions carry their own risk. The FDA logged more than 450 injury reports tied to compounded semaglutide. Dosing errors, some serious enough to put people in the hospital. Investigators found fake labels and pharmacies named on those labels that did not exist. Here's the uncomfortable truth that ties it together. A drug is only a bargain if it's the real drug, at the real dose. At these prices, and with demand this desperate, that is exactly what counterfeiters exploit. The further the pen travels from a regulated pharmacy, the harder that question gets to answer. So here's the honest picture, both sides on the table. The savings are real, thousands of dollars a year on a medicine that millions of people now build their health around. And the risks are real, too. A legal gray zone and a flooded counterfeit market that does not care about your safety. But step back, because the border run is the symptom, not the disease. The disease is the price itself. Nearly $1,000 a month for something researchers say costs about $5 to make. No day trip fixes that. What actually moves it is what's finally arriving in 2027. A negotiated price, a lower sticker, and the public pressure that forced both. Nobody should have to weigh a counterfeit gamble against their rent. And the fact that so many are doing exactly that. Math tells you everything about where the real problem lives. You shouldn't have to go broke to feel whole.